Well, Gundersen Health System and Bellin Health, as we've reported, are working to complete details on a merger. News 19's Dave Soley spoke with leaders from each facility about, Dave, how these two came together.
Yeah, Dustin, that's where we began our conversation. We started talking about why work to merge with an organization on the other side of the state.
That is the number one question.
The answer is found in three primary issues. Gundersen CEO Scott Rathgaber says they want to continue providing a good experience through high quality and affordable care.
And so in order to do that, we want to make sure that we are strong for the future, and that means working with other organizations that have that same mindset. And that's where our talks with Bellin have been very fruitful.
Bellin Health is a more than 100-year-old provider in Green Bay, where Chris Waleski is the president and CEO. She says, for example, the merger will support the three issues Rathgaber identified, using emerging technology as an example.
What all of those technologies have in common, two things. One, they're very expensive, and two, they're changing rapidly. So for health systems the size of Bellin or the size of Gundersen, to have the capacity to invest in a lot of those technologies is obviously limited. So together, rather than duplicating the investments in the same things, we can actually pool our resources to be able to invest in the right things and to do it together and to implement it together, and I think provide a better experience for our patients that way in terms of accessibility to healthcare.
Another benefit is knowledge. Waleski says each hospital has its own unique expertise, and under this proposed merger, they can share that much more easily with one another.
We are so committed to the triple aim, as we call it, and just continually working to improve quality and be at the very best, to continually work to listen and understand what our patients and their families need, and to deliver that kind of an experience. And to understand and appreciate that healthcare is too expensive. And we need to always be working at making healthcare more affordable for everyone.
Rathgaber says over time, the goal is improving affordability through the kind of efficiency Waleski described.
If we're going to still be here decades later, we think our odds of doing that are better together with a committed partner who believes the same things that we do than if we go separate.
Gundersen serves patients in 3 states and 22 counties, 14 counties and 2 states for Bellin Health. Both, Dustin, have done that for more than 100 years.
All right, thanks, Dave. And Rathgaber told us they're working to reach a definitive agreement by the end of this summer for government review. Then that process, he says, could take another 3 to 6 months.